Hi everybody, and welcome to another episode with The Anxious Resistance. Today I'm going to be talking about a brand new antidepressant. This one just hit the market in September of 2023, and I really want to talk about it because it is different. It is a little bit unique from a lot of the stuff that are current line antidepressant treatment. So the medication that I'm going to be talking about is called Gepirone. Now, Gepirone is a novel antidepressant, meaning it's a new antidepressant that was approved by the FDA in September 2023 for the treatment of major depressive disorder, MDD, in adults. It belongs to a class of drugs called azipirones, which are similar to buspirone, a medication used for anxiety disorders. Gepirone is taken orally as an extended release tablet, which means that it releases the drug slowly and steadily into the bloodstream over a longer period of time. This allows for a more convenient dosing schedule and a lower risk of side effects compared to immediate release formulations. Okay, so let's talk a little bit about how Gepirone works exactly. The exact mechanism is not fully understood, but it is thought to be related to its effects on serotonin, a neurotransmitter that is involved in mood regulation, among other functions. Serotonin acts on different types of receptors in the brain, and some of them, such as the 5-HT1A receptors, are believed to play a key role in depression. Gepirone acts as a partial agonist of the 5-HT1A receptors, which means that it stimulates them to a certain extent, but not as much as the natural serotonin would. This way, Gepirone can modulate the serotonin activity in the brain and restore the balance of this important chemical messenger. So what is the evidence for use for Gepirone? Gepirone has been tested in several clinical trials involving thousands of patients with major depressive disorder. The FDA requires at least 2 positive trials to approve a new drug, and Gepirone met this criterion after many years of research and development. And again, this is talking about 2 phase 3 clinical trials. So this is kind of far down the line. Usually with phase 3, they do it with a lot of people, and they do it over different areas, geographies, that kind of thing, so that they can see exactly how effective the new medication can be. So the 2 positive trials showed that Gepirone significantly reduced the symptoms of depression compared to placebo, as measured by the Hamilton Depression Rating Scale, a widely used tool to assess the severity of depression. The effect size of Gepirone was similar to that of other approved antidepressants, so that means the effectiveness of Gepirone is comparable to what we already have, including that it is an option for treating major depressive disorder. In addition, Gepirone also showed some benefits in reducing anxiety and enhancing sexual function, which are common problems associated with depression and some antidepressants. Again, this is huge. Many out there know the antidepressants can have a negative effect on sexual function, libido, sexual drive, all of those things. So if we have more antidepressants that don't have those side effects, the better. And again, later on we'll talk about it, but this can actually enhance the sexual function. So that means that, say you're taking Prozac or you're taking Lexapro or one of the really common antidepressants, and you're having some sexual dysfunction as well as some depression still. So this medication should be able to be added onto an SSRI, an SNRI, and hopefully it will enhance and even help with that sexual dysfunction, and it will also help with the depression. So this is a really unique antidepressant that could be beneficial in treating things like that, and we know just how important those things can be. So Gepirone belongs to a different class of antidepressants than most of the commonly used other ones, such as SSRIs and SNRIs that I've already mentioned. These drugs work by blocking the reabsorption of serotonin and or norepinephrine in the brain, thus increasing their availability. However, this can also cause some unwanted side effects such as nausea, insomnia, weight gain, sexual dysfunction, and withdrawal symptoms. Gepirone, on the other hand, does not affect the reuptake of serotonin or norepinephrine, but rather acts directly on the 5-HT1A receptors, which may result in a more favorable side effect profile and a lower risk of dependence or discontinuation syndrome. So how is Gepirone taken? Gepirone is typically taken once a day, preferably in the morning, with or without food. The recommended starting dose is 20 milligrams, which can be increased by 10 milligrams every week, up to a maximum of 80 milligrams per day, depending on the response and tolerance of the patient. The dose should be adjusted by the doctor according to the individual needs and characteristics of each patient. Gepirone should not be stopped abruptly, but rather tapered off gradually under the supervision of the doctor. Gepirone should not be taken with alcohol or other drugs that can interact with it, such as monoamine oxidase inhibitors, ketoconazole, which is used to treat fungal infections, erythromycin, which is an antibiotic, or grapefruit juice. Again, grapefruit juice has a lot of interactions with different medications. Generally, if you're on a prescription med, you might want to just avoid grapefruit juice, just in case it interacts with whatever you're taking. So, what are the common side effects with Gepirone? Gepirone is generally well tolerated by most patients, and the most common side effects are mild and transient. The most frequently reported side effects are dizziness, nausea, insomnia, abdominal pain, and dyspepsia or indigestion. These side effects tend to decrease over time as the body adapts to the medication. Some patients may also experience headache, fatigue, diarrhea, constipation, dry mouth, or sweating. Gepirone may cause drowsiness or impaired judgment, so caution is advised when driving or operating machinery. Gepirone may also lower blood pressure or cause irregular heartbeats, so patients with cardiovascular problems should consult their doctor before taking it. So what are the contraindications or precautions involved with using Gepirone? Gepirone is not suitable for everyone, and some people should avoid taking it or use it with caution. Gepirone is contraindicated with patients who are allergic to it or any of its ingredients, or who are taking MAOIs or have taken them in the last 14 days. Again, you have to get those MAOIs out of your system. They will interact with Gepirone. Gepirone should also not be used by pregnant or breastfeeding women, as the safety and efficacy of the drug in these populations have not been established. Gepirone should be used with caution in patients with liver or kidney impairment, as the drug is metabolized and excreted by these organs. Gepirone should also be used with caution in patients with bipolar disorder, as the drug may induce mania or hypomania in some cases. Gepirone should be used in caution with patients with a history of suicidal thoughts or behaviors, as the drug may increase the risk of suicidal ideation or action in some patients, especially during the initial phase of treatment or when the dose is changed. Patients should be monitored closely by their doctor and family members and report any signs of worsening depression, agitation, or unusual changes in mood or behavior. So let's talk a little bit about the pros and cons of Gepirone use. Gepirone is a new and promising antidepressant that offers some advantages over the existing options, but also some limitations and challenges. Some of the pros and cons I will summarize for you here. The pros are Gepirone is effective in reducing the symptoms of depression and has similar effect to other antidepressants. Gepirone has a more favorable side effect profile than other antidepressants, with a lower incidence of sexual dysfunction, weight gain, insomnia, and withdrawal symptoms. Gepirone has a convenient once-daily dosing schedule and an extended release formulation that ensures a steady drug delivery and reduces the risk of side effects. Gepirone may also have some benefits in reducing anxiety and enhancing sexual function, which are common comorbidities and complications of depression and some antidepressants. Okay, so what are some of the negative takes on Gepirone? Gepirone is not considered to be a first-line treatment for depression. It is only indicated for adults with MDD, so this is not indicated for children yet. It is not approved for other types of depression, such as dysthymia, postpartum depression or seasonal affective disorder, or for other psychiatric disorders, such as anxiety disorders, obsessive compulsive disorders, or post-traumatic stress disorders. Again, gepirone may have some efficacy in some of these disorders. We don't really know yet. There's still research that's ongoing. A lot of times they just try to get a drug approved for one indication so it can hit the market, and then kind of that post-marketing research will determine whether or not it can be effective for some of these other things. And again, if it is, doctors begin to prescribe it off-label for these things. I imagine that it may help with some of them, such as anxiety disorders, seasonal affective disorder, dysthymia. I do believe that it may help with some of those, but again, the research is not there yet, so we need to wait for it. Or if you're running out of options for some of those disorders, then you still can consider this a possible treatment. Gepirone may take longer to work than other antidepressants, and it may require a higher dose to achieve the optimal response. Some patients may not respond to gepirone at all. This is true of any antidepressant, most anxiolytics. You just don't know. They just might not work. People may also experience a relapse of depression after a period of remission with gepirone. Again, this is called antidepressant tachyphylaxis or antidepressant poop out. This happens with most antidepressants and can happen to anyone. It's just kind of when the brain adjusts and makes adjustments so that your antidepressant no longer functions as well as it used to. So gepirone may also cause some side effects, as I mentioned before, like dizziness, nausea, insomnia, abdominal pain, and dyspepsia, which may affect the adherence and quality of life in some patients. So again, it just depends. Some of these side effects may go away with time. This is true of most antidepressants. If you have certain side effects that are mild, they may just mitigate with time. Again, you want to be careful operating machinery when you're taking gepirone. It may have cardiovascular effects like lowering blood pressure, so you may want to watch for any dizziness. Gepirone may interact with other medications such as MAOIs, as I mentioned before, ketoconazole, azithromycin, or grapefruit juice. So these increase the risk of adverse reactions or reduce the effectiveness of the drug, so you need to stay away from them. So gepirone may increase the risk of suicidal ideation or actions in some people. Again, this is true of pretty much any antidepressant, and that's why they have a black box warning. So you need to be sure that you're monitoring yourself, making sure that if your depression gets worse, make sure you understand, like, okay, well, there was a trigger in my life that led to this. Because if there's not, then maybe it's the medication. You kind of need to have that self-awareness to know, okay, I haven't had any triggering events for my depression. There's nothing that's going on that would have made it worse, but yet I feel terrible and I feel suicidal even more so than I have been. It may be the medication that does that. So in conclusion, gepirone is a new antidepressant that has been approved by the FDA for the treatment of MDD in adults. It works by modulating the serotonin activity in the brain through selective agonism of the 5-HT1A receptors. Gepirone has been shown to be effective in reducing the symptoms of depression and has a similar effect size to other antidepressants. Gepirone has a more favorable side effect profile than other antidepressants, with a lower incidence of sexual dysfunction, weight gain, insomnia, and withdrawal symptoms. Gepirone may also have some benefits in reducing anxiety. Thank you guys so much for watching this video. If you enjoyed it, please like it, subscribe to our channel for more content just like this. We do our best to spread information about all kinds of mental health treatments and things that you can do to increase the quality of your life and help you live more fully to your potential. Thank you guys so much for watching, and I'll see you next time.